I wanted to be a nurse since I was about 5 years old. I was born a preemie and spent most of my early years in the hospital, so in and out. And I remember the nurses pretty vividly, and the nurses were amazingly tender and kind.
I went to high school right up the hill, so I knew from pretty early on I wanted to stay and help support this community where I grew up in. I thought I wanted to go into medicine just because, it's interesting and it stimulates my brain or whatever. But really when I started to work in healthcare, the part of it that I enjoyed the most was really true connection with the patients and the trust that patients had in us as healthcare workers.
And altogether, I've been a nurse for 39 years, and I can't imagine doing anything else. I love teaching patients about their health and celebrating their successes when they make changes that result in better health.
I absolutely love nursing. I mean, it's so meaningful to touch people's lives, even if it's for 30 seconds or 15 minutes as a nurse practitioner. I'm grateful for where my career has taken me, and I'm really grateful to be a part of HealthPoint.
My favorite moments are those light bulb moments with the patients where their health becomes more than something that, so-and-so is telling you have to take this medication and that medication because of this number and that number, and to that kind of shift to, okay, so this is why these people care about my health and this is why this matters to me.
So one of the unique aspects during the pandemic is how nurses were able to advocate and educate our communities.
We've all seen how COVID has hit communities of color and those of lower socioeconomic status doubly hard, right? So higher rates of COVID morbidity, mortality, but also bearing the brunt of the economic impact of the pandemic. And then on top of that, when vaccine came out, it very quickly became clear the inequities in access to that as well, right? So for me, all the more important to help bridge that gap and address the need in bringing our communities access to vaccine. What started as just volunteering for one or two events after hours to help vaccinate our staff quickly became getting involved in nearly every event, whether it's after hours or on the weekends for our staff, our patients, but also our communities around us. It's more than just vaccination, it's more than just poking an arm. It's really about bringing vaccine access to these people who otherwise may or may not have access to this. I've had people cry of happiness when they first got their vaccine, and those are the things that really get me going, right?
It's really about being there, listening, engaging, and really creating that trust around not just getting a vaccine, but why they're getting the vaccine. Why do they want it in their community? Why is it culturally appropriate to have the vaccine, and do it in a sensitive manner.
Partnering with trusted organizations really, to me, exemplifies what the essence of community health is, and I've been honored to be a part of that.
What I love about HealthPoint nurses are they are the voice and advocate for our patients. Although we come from all different parts of the world, many of us speak multiple languages, we're of different genders, we're different ethnicities, is we come to HealthPoint because we care. Whether they're out in the community working with our homeless population, those in shelters, whether they're in a clinic working with new moms, families coming in as refugees or new immigrants, or whether they're out working in a vaccine clinic or testing site, HealthPoint nurses make a difference every day. HealthPoint's a place where you can grow as a nurse, you can engage, you can make a difference, and we do that every day amongst our nursing team.